one. You're up. Go ahead and share your screen. Now I got to put my mask on because kids are going to come in here.
Is it sharing or?
Yep, you're ready to go.
Okay.
So I guess you would just hit play on yours and it would totally share on mine. That's perfect. And
Awesome.
I'm actually going to mute my microphone just in case someone comes in.
Okay.
But I'll be right here. So I'm here listening. So don't think I'm ignoring you.
All right. Perfect. So I'm assuming we're just starting from the start, and then as I get to the next screen, do I pass it forward or?
Yeah, you would go ahead and pass it forward by your arrows or your mouse or however.
All right, I will do that, and it'll be awkward because I'll be reading. I'm not fully prepared, so.
Oh, you're going to be perfect. I know you will.
All
You
right.
always are.
Okay.
So I'm going to mute mine. So it's just.
Okay. Good morning. My name is Djimmer Bosman. I'm a physical therapist. I was invited to talk to you this morning about physical therapy, or this afternoon, whatever day it is. A little bit about myself: born and raised in the Netherlands, graduated from physical therapy school in the Netherlands, and in 1990 moved to the United States. Have a small private outpatient clinic just up the street from Creek. It's in Bellevue, on Bellevue and Ulster, a little shopping center called Marina Square. We specialize in injury prevention, orthopedic rehabilitation. We see a fair share of spine patients as well. It's myself and my colleague Christian, so the two of us run the clinic. My wife is also a physical therapist. She's a pediatric physical therapist, doing a lot of home health. We have 3 kids, 2 in college, 1 graduated from college, none looking forward to becoming a physical therapist. So I have to find somebody else to pass on the clinic. What I'd like to do today is give you a little bit of insight in the profession of physical therapy, which is quickly growing in importance and development. Unfortunately, not as respected as it maybe should be in healthcare, but I think there's a lot of room for us to become part of the gateway in healthcare, like you would see with a primary care physician or a PA, an internal medicine doctor, where people go to for their primary injuries. So I will go through these slides, try to keep up, and then I'm pretty sure at some point in time you guys will be able to ask me any questions, either via email or text, or however this is going to work in this exciting COVID year.
Yeah, I will actually, I have a spot when they watch the videos that they can type up any questions, and I'll just email the questions to you, and then I'll post them once you have returned them.
Excellent. Excellent. All right. Slide number 1. This always gets everybody's attention. That is the left leg of one of my patients. This slide is now 2 years old, so it's still pretty impressive. A young lady that I worked with who got her leg caught under her car. She got out of her car when she thought she had a flat. Car was not in park, so the car rolled backwards over her leg and split her leg open. These are not very typical injuries, but in general, if you see these type of injuries to a lower extremity, upper extremity, you wouldn't necessarily immediately think physical therapy, but this is something that that needed to be addressed. Besides the fact that she has a pretty impressive flesh wound there that needs to be cleaned and stitched up. She also dislocated her ankle. So as you look at her ankle, it is no longer lined up properly with her lower leg. So that got relocated, required some internal hardware, and that's where the physical therapy comes in. So you can fix people up with surgery. Most surgeons will tell you that you will not regain all of your function without use of physical therapy. So there's a platform and a use for us there. So physical therapists, who we are and why we are. We have been described by various agencies. The APTA relates physical therapies as PTs help patients reduce pain improve mobility and teach them how to prevent or manage their condition. Very nice and vague. That's applicable to multiple professions, not just physical therapists. But explore healthcare careers, an organization that helps people decide what part of or aspect of healthcare they might be interested in. PTs are evidence-based healthcare professionals who diagnose and treat individuals of all ages who have medical problems or other health-related conditions that limit their abilities to move and perform functional activities in their daily lives. Quite a mouthful. Still doesn't really describe what PTs are, what they do. Moving on, Bureau of Labor Statistics. Physical therapists help injured or ill people improve their movement and manage their pain. Concise but incomplete because we do a lot more. We help healthy patients as well. So people who do not have any injuries but have maybe postural problems or lower back pain or things that is not necessarily an injury or a problem yet. We can work with them as well as injury prevention. So those who may be at higher risk of an injury because of posture or previous problems can be helped as well. The next one, FMS, Functional Movement Systems, is a group of physical therapists that I belong to that use a very unique diagnostic tool called FMS. And it looks at movement patterns more so than singular movements. So instead of looking at how well does somebody bend or straighten their knee, we look at how well does somebody walk, how well does somebody squat, how well can somebody step over something. And so movement is very important, and that's where most physical therapists will fall in, assessing and treating movement. So concisely, move well and move often. That's what physical therapists will hope to gain from your treatment. We'll go to some slides about history of physical therapy. I'll try to go through this as quick as possible because this is always boring. A brief history of PT, middle-aged spine adjustments. PTs are often referred to as physical terrorists. Not true. Or inflictors of pain and torture. That's what the initials PT stand for. Initially, there was a group of physiotherapists that organized themselves in the late 1800s in England. Everywhere else in the world, by the way, physical therapists are referred to as physiotherapists, not physical therapists. So physio is describing exercise as in physiology or movement as in kinesiology. So so that was in the late 1800s, and that didn't look anything like this. The profession ballooned after World War I as many injured soldiers returned. So as war became more, more aggressive and healthcare or first aid on the battlefield became more successful, we started seeing more soldiers return with life-altering wounds, loss of limbs, and what have you. So many injured soldiers returned, and in order to improve their function, there was a group of nurses who had training in physical education as well as massage therapy that started to work with them. So that was one of the first physical therapists. That doesn't look like a physical therapist nowadays. That looks like a classic nurse's outfit. But so basically what they were working on was return of function. So getting somebody to move their arm and leg, learning them how to, or teaching them how to walk, things like that. 40s and 50s, they started adding exercise, traction, manual therapy to the profession. Manual therapy is a specific movement or mobilization of joints based on what normal healthy movement would look like. Physical therapy moved out of hospitals into nursing facilities, schools, rehab centers, as well as outpatient clinics. The first outpatient clinics didn't really show up in the US until probably the mid to late 70s. This is an example of manual therapy. There is there's an area of treatment where chiropractors and physical therapists coincide in types of treatment, and this would be one of them. The biggest difference would be that chiropractors will have a tendency to consistently manipulate or quote unquote pop their joints. Most physical therapists won't. They will articulate or gently gap or stretch the joint in order to get them to move. In addition, specialized modalities came about. So electrical stimulation, infrared light treatment, ultrasound, which is sound waves utilized to either break up scar tissue or improve circulation. And then the boom of outpatient PT happened in the 80s and 90s. Some of that had to do with the increase in activity level of people. More free time resulted in more abilities to be active, including running, jogging, working out, things like that. And the second reason was the invention of arthroscopic surgery, which made it a lot easier to perform surgery in small areas. So the arthroscope, as you can tell there, is a tool that can be inserted into a joint after the joint is filled with fluid. That's what the cannula is for. Initially, that was reserved for shoulders and knees. Nowadays, we can do it in hips, elbows, wrists, and ankles. And the advantage is that you have smaller incisions, less chance for infection, and quicker return to activity, as well as physical therapy. This looks very gentle. It isn't. If you've ever seen an arthroscopic surgery, it takes a lot of force to move the scope around inside the joint. Physical therapy locations, where do PTs practice? I already hinted at it earlier that it's initially started in hospitals and nursing homes. Hospitals, 3 different types of PT are usually found here. Orthopedic, which means post-surgeries, after fractures, joint replacements, and the primary goal is to get people up and move, to prevent blood clots, to prevent stiffness. And as sooner people can move, the sooner they can leave the hospital, and hospitals are great places to leave. Neurological patients, acutely following strokes or spinal cord injuries, such as like types of paralysis or injuries. Again, trying to get patients up and moving. The other patients that you might see in a neurological setting would be patients with chronic neurological problems, such as Parkinson's or multiple sclerosis. And then the third one, wound care, which is becoming less and less of a PT issue. It's very specialized. For example, the treatment of patients with severe burns. A lot of times now that is done by specialized nurses, not as much by PTs. Next one, rehabilitation centers. After patients get discharged from hospitals and are medically stable, they can continue their rehab in a rehab facility. A well-known rehab facility in the Denver metro area is Craig Hospital. The basic deal there is to restore function, so get patients to start moving more functionally, such as walking, going up and down stairs, getting in and out of a car, and getting them ready to return to their normal daily activities. So driving, dressing themselves, going to work, things like that. Skilled nursing facilities or nursing homes. Talking too much, getting a cough. Patients with chronic ailments, injuries, disabilities, who cannot go home or do not have any help at home, will go to a skilled nursing facility. This could be a temporary thing where patients would spend 2, 3, 4 weeks there after a joint replacement, for example, or it could be permanent, patients who have progressive illnesses or diseases. PT's main job there is to progress with movement and strengthening, and try to get the patient independent enough to be able to return to home, or try to maintain as much function as they can while they're in this nursing facility. Home health physical therapy is exactly what it says, growing in popularity. A lot of patients are uncomfortable staying in hospitals or staying in skilled nursing facilities, want to go home as quickly as possible where the risk of infection and other issues is considerably smaller. And so they will go home and receive home health physical therapy there. Schools. This is something that kind of comes and goes. So we used to have schools that were specifically set up to treat children with disabilities or developmental problems. Nowadays, this is more assimilated in regular schools, but there's still a use for speech therapists, occupational therapists, and physical therapists as well. Outpatient clinics, probably the most common ones now. We predominantly treat patients pre or post surgery. So if somebody is scheduled to have a joint replacement, they may get some PT prior to surgery. Patients who have injuries, acute injuries, sports-related injuries, falls, crashes, etc., as well as posture-related problems. So we see a lot of lower back and neck problems. Over the course of the last 6 months, we've definitely seen more neck issues as more and more of us are now clustered and strung to our computers. And then the last one is PTs who are affiliated with a sports team or sports facilities. Couple of pictures. If you look at Mr. Silva, his leg is not in the angle that it's supposed to be. He's definitely going to need some type of physical therapy at some point in time. Massive hematomas or bruising is commonly seen after falls or injuries. We also see it after surgery sometimes, especially with total knee replacements, which can be quite graphic. And this is one of my favorite. I know Mr. Sturp has seen this before. This was a cyclist in the Tour de France who was cut off by a car, ended up stuck in a barbed wire fence, and it shredded his, not just his outfit, but also his thighs. So I'm not sure if he needs physical therapy. It's just a cool slide. So how do I become a physical therapist? First, you earn your bachelor's degree in a health-related field. This could be exercise physiology. This could be kinesiology. This could be pre-med. So there's lots of different ways that you can earn your bachelor's or undergrad degree. Athletic training is another way. And then you decide that you want to be a physical therapist. You sign on with an accredited PT school. All schools now graduate PTs with a DPT degree. The D stands for doctor. It does not mean that you become a medical doctor. It's not a PhD or a doctorate. It just means that you have to spend a couple more months in school. And so now instead of a master's degree, you have a doctorate degree. And there are 228 PT programs across the country, give or take. There's a couple here in the States. Regis University has a PT program, as does CU. You need prerequisites. Most of the time, the schools will help you with this. You'll need specific college courses, such as anatomy, physiology, biology, chemistry, physics, psychology. A lot of schools will have a minimum GPA requirement of more than a 3.5. Quick side note there, I've had several students that did not have the 3.5 GPA. You can still apply to the schools with letters of recommendation. One of the students that I'm most proud of, she was an aide for me, a PT aide in the clinic for 2.5 years, bright young lady. Did not have excellent grades. She redid some of her scores. She redid her GRE a couple of times, applied to CU, did not get accepted. The following year, she applied again, and we wrote multiple letters of recommendation for her. She did get accepted this time, with less than a 3.5 GPA and promptly became student of the year 2 years in a row. So don't let the grades discourage you from applying. It will, however, be a lot easier to get accepted if you have a higher GPA, unfortunately, because that doesn't necessarily make you a good PT, but that was my little rant. Complete the state board licensure exam. So once you graduate from an accredited PT school, you have to take a board exam. The board exam will be taken usually within 2 to 3 months after graduation, and that will give you your license and will allow you to start working. Most state board exams now are accepted throughout the country. So it used to be where you would take a state board licensure exam in the state that you wanted to practice. And then there was some reciprocity with different states, but most of the time you can practice in every state except for California. California requires an oral exam as well. PT specialties. So one of my favorite quotes when I was teaching at a PT school was that when you graduate from PT school, you will have a basic toolbox with basic tools like a hammer, a saw, a pair of pliers, and a screwdriver, and that's it. And with these simple tools, you go out in the PT world and start helping people recover. Once you start doing that, you'll realize that there's lots of different specialties and areas that you might be interested in. And so some of the specialties I'll list here, and those are usually specialties that you will not get into until after you graduate. Cardiovascular and pulmonary PT is exactly what it says. Working with patients who've had a heart attack, patients who've had lung replacements, patients who have severe COPD or asthma or other breathing issues. Very specialized area. There's a great hospital here in Denver, National Jewish, where they have some of the top pulmonary rehab facilities in the country. So if you're interested in that, that's a great place to go volunteer. That's an example of having somebody who has some breathing issues and applying physical therapy there. Clinical electrophysiology. I come back to this every year. I'm not really sure what this is. So I had to look it up. The use of biofeedback is one of the things that is done here. Biofeedback is using electrical signals to control muscle spasms. So you have electrodes on your body, and as you tense your muscles, the sound that you hear becomes louder. The clue is to try to make that sound as minimal as possible. So you learn muscle control, muscle activity, things like that. Geriatrics, working with the elderly population, which will become more and more popular and more important as the population grays over the next couple of decades. This could be working in a nursing home, but it doesn't necessarily have to be limited to a nursing home. You could work in a retirement community. You can specialize in geriatrics in outpatient clinics. You can also work with special programs like Silver Sneakers, for example, which is big in the exercise community. So lots of opportunities and options there. Great photo. Neurology, working with quadriplegic, paraplegic, stroke patients, patients with multiple sclerosis, patients with muscular dystrophy. So these are, generally speaking, more long-term relationships, working more on maintaining function or preventing loss of function than it is on regaining function. This can happen in places like Craig Hospital, the rehab facility. It can also happen in nursing homes or rehab facilities. Oncology, some physical therapy specialty, working with cancer patients. For example, patients who've had problems with lymphedema and lymph drainage. PTs have a function with that. If you work on in a trauma area where patients have traumatic surgeries following large bone tumors or osteosarcomas. PT is needed there to teach people to walk again after having either massive surgeries or amputations. Orthopedics, the most or more common one, is basically everybody who has an injury to their musculoskeletal system. So if you sprain an ankle, that falls under orthopedics. If you have a meniscus tear in your knee and you have surgery, that falls under orthopedics. If you hurt your back lifting something heavy, that also falls under orthopedics. So that's a wide variety of injuries. Pediatrics, this is a specialty, and you can actually become certified, NDT certified, which can take up to 2 years. You have to have a vivid imagination and a lot of patience. This is not for everybody. I don't know how my wife does it, but she's very good at doing pediatrics. You have to like spit and all the other stuff too. Sports physical therapy, that's what everybody wants to do. This could be working with a sports team. This could be working with a club team. This could be working with a high school, with a gym. So there's lots of ways that you can be involved in sports. However, you will get introduced to a lot of sports specialties just working in an outpatient clinic or working with orthopedics. And then the last one, this is a growing area of specialty. There are actually women's health clinics in town now where they focus on pre and postpartum, so before or after pregnancy related problems, ailments, and injuries, as well as, for example, incontinence, so having problem controlling urination. So a lot of talking, a lot of things that you can look at or look into. Coming back real quick to the schooling, one of the things in addition to having a good grade that is very important is volunteer experience. So and each school has a different specific number of hours required and different settings. So volunteering or shadowing in an outpatient clinic, in a rehab facility, in a hospital, things like that. So you can start that even in your high school career if you're set on having a career in healthcare. So volunteering is always something that looks good on your resume. So summarizing, physical therapy, their strongest clinical skill, and this is something that I referred to earlier on as well, is first line of defense. So you have to be able to assess or diagnose well. So when somebody comes to you without having seen a physician, and you can do this in Colorado. Colorado is a direct access state, meaning you do not need to see a doctor before you go see a physical therapist. So if you sprain your ankle and you want to go see your therapist first, you can do that. And what this means for the physical therapist, he has to have an excellent assessment ability to make sure that, rule out that you have a fracture in your ankle instead of just a sprain. So I firmly believe that PTs are going to become more involved in this first line of defense, especially since we're going to run out of primary care physicians or family physicians in the near future. I'm going to stop with move well and move often. If you have any questions, concerns, problems, what have you, Mr. Stirrup has a way for you to get a hold of me. If you're interested in volunteering or in shadowing, you can do that at our clinic as well. If you want to just stop by and see what the clinic looks like, what it's all about, feel free to do so. Excuse me. Make sure that you contact us first. Don't just pop in. So that we're sure that we have time for you. And especially nowadays with COVID, we do have limited availability in the clinic. We're trying to keep people as far apart as possible. So, but as soon as the world goes back to normal, you can stop by as often and as frequently as you want to hang out with us, ask us lots of questions, and see if maybe this is a career path for you. And I'm going to hand it back to you, sir.
Great job. That was, as always, I always enjoy it. And thank you so much for offering the opportunity for our kids to come see you. And obviously, I think they all get it. I mean, we're actually a regular size high school now, being we only have half the students on Tuesday,
2,000
Wednesday.
kids. Yeah, that's amazing.
But I appreciate you. I will be posting this in the next couple of weeks for the kids to watch. And if they have any questions, I will then email you any of their questions they have. And then including if someone says, hey, I want a shadow, I will send you an email with the kids' information. And if you would like, I could give out your information once you give me the thumbs up for it. So
Absolutely. Yeah, you can share it with anybody who's interested. So no need to ask. So either the website or my email, you can give all the information out.
I appreciate that so very much. So I'm going to go ahead and stop our recording, but it'll keep our Zoom going.